Hello and welcome to this learning module. Today we will discuss the assessment and management of patients experiencing allergic reactions. This video is intended to supplement any readings or coursework assigned by your instructor. Upon successful completion of this learning module, students will be better able to differentiate the terms antibody and antigen, discuss the pathophysiology associated with allergic and anaphylactic reactions, and assess and treat victims of an allergic and anaphylactic reaction. The immune system protects the body from harmful substances by recognizing and responding to them quickly and usually pretty effectively. We cannot talk about the immune system without discussing antigens and antibodies. These terms are unique because you can't define one without using the other in its definition. An antigen is any substance that causes our immune system to create antibodies against it. This means that the immune system does not recognize the substance and is trying to fight it off. Antigens are substances found on the surface of foreign cells, including viruses, fungi, and bacteria. Non-living substances such as toxins, chemicals, drugs, and foreign particles such as a splinter can also be antigens. Antibodies are proteins produced by the body in response to the presence of an antigen. The immune system recognizes and destroys or tries to destroy substances that contain antigens. You may also hear antibodies referred to as immunoglobulins. Each type of antibody is unique and defends the body against one specific type of antigen. They attach to the antigens and remove them from your body, which is illustrated in the image here on the slide. This antibody's antigen binding site is specific to the yellow antigen. Other antibodies in the blood and lymphatic system will have antigen binding sites for the remaining colored antigens seen in this image. Our body's cells also have proteins that are antigens. These include a group of antigens called HLA antigens, which help the body differentiate cells that should be present in the body from those that are dangerous. Your immune system learns to see these antigens as normal and usually does not react against them. If the human body mistakenly attacks these HLA antigens, this is referred to as an autoimmune disorder. This is what happens to the body when it attacks the cells of the pancreas in a patient with type 1 diabetes. An allergic reaction is a misdirected and excessive response by our immune system to a specific type of antigen called an allergen. Essentially, the immune system overestimates the danger of the allergen and produces an elevated response to this perceived threat. Sometimes the response is localized to one area of the body, and other times it can be a systemic response throughout the entire body. Most antigens that enter the body are easily fought off by the immune system and do not result in an allergic response. Our immune system releases chemical mediators called histamines in response to the presence of an allergen. These chemicals cause many of the classic symptoms that are characteristic of an allergic reaction, including watery eyes and a runny nose, which are the body's way of removing the allergens. In more severe reactions, histamine release causes bronchospasm in the lungs, which can cause wheezing and dyspnea, widespread vasodilation, and an increase in capillary permeability, which leads to fluid leakage from the vascular system, a decrease in cardiac output, and a decrease in blood flow to the heart muscle and throughout the rest of the body, and swelling and rashes of the skin. Allergens can access the body through skin contact, such as poison ivy, injection from a bee sting, ingestion of foods such as peanuts or a medication like penicillin, and inhalation of pollens and dust. An anaphylactic reaction is a severe and systemic immune response to an allergen. When this happens, the histamines released by the body cause swelling, bronchoconstriction, and vasodilation. In each of these circumstances, the body is attempting to prevent the allergen from accessing different parts of the body. Unfortunately, however, this attempt to protect the body puts the organism in a life-threatening situation. After being exposed to a substance such as bee sting venom, the person's immune system becomes sensitized to it. When the person is exposed to that allergen again, an allergic reaction can occur. Anaphylaxis happens quickly after the exposure. The condition is severe and involves the whole body. Anaphylaxis can lead to airway and respiratory system compromise, as well as complete circulatory collapse. table on this slide lists the reaction of different organ systems during anaphylaxis, as well as the signs and symptoms that can accompany the reaction. As you can see, some of the reactions, such as rhinitis and skin redness, swelling, and itching, are a nuisance and pose little or no life threat. Other reactions, such as laryngeal edema, bronchoconstriction, and cardiovascular collapse, are extremely life-threatening. Please pause this video for a moment to review the signs and symptoms for each organ system. The image on the left shows a patient experiencing angioedema that results in swelling of the deep layers of the skin and mucous membranes. The concern in patients who present this way is swelling and obstruction of the airway. The image at the top right corner of the screen shows a skin reaction that is called urticaria. Urticaria is the medical term for hives. The image at the bottom of your screen shows a patient with a specific type of urticaria called a wheal. Wheal is spelled W-H-E-A-L. Wheals present as raised and itchy bumps on the skin. Emergency medical care for an allergic reaction includes taking steps to eliminate exposure to the allergen. For example, if a patient was stung by a bee and the stinger is still in the skin, we need to use a credit card or other similar object with a stiff edge to scrape the stinger away from the skin. We don't want to use tweezers or forceps to try and remove the stinger. If the venom sac is still attached to the stinger, as seen in the images here, the pinching motion of the tweezers will squeeze additional venom into the patient. Notice that the stinger is just as sharp as a hypodermic needle we're going to use to administer some epinephrine to the patient if required. After removing the stinger or other allergen, we should wash the area with soap and water and remove any jewelry on the extremity in case the extremity begins to swell. Application of ice or cold packs will help prevent swelling and may make the patient a little more comfortable. We need to monitor this patient very closely to ensure that they do not experience any signs of anaphylaxis. If a patient is experiencing mild signs and symptoms of an allergic reaction, including rash, hives, and mild wheezing, we can administer diphenhydramine or Benadryl and can also consider administering a nebulizer treatment with albuterol to help with the wheezing. Diphenhydramine is a histamine blocker and is usually administered at 1 milligram per kilogram to a maximum dose of 25 milligrams orally for children and 25 to 50 milligrams orally in adults. If, however, the patient presents with a systemic response, including moderate to severe signs and symptoms, they should administer epinephrine immediately. Epinephrine causes widespread vasoconstriction to increase the victim's blood pressure and also causes bronchodilation to help with the wheezing. Moderate to severe signs and symptoms may include mucous membrane involvement such as angioedema, altered mental status, severe wheezing or stridor with associated respiratory distress, and or extreme hypotension. When administering epinephrine using an autoinjector or EpiPen, as seen in the image on the left of the screen, the doses of a pediatric autoinjector is used for kids weighing less than 30 kilograms or 66 pounds, and an adult autoinjector is used for individuals weighing 30 kilograms or more. Due to the rising cost of epinephrine autoinjectors, many medical directors now allow their EMTs to draw up epinephrine 1 to 1,000 concentration from a vial like the one that's seen in the middle image on your screen. This is administered intramuscularly using a needle and syringe. For children weighing less than 30 kilograms or 66 pounds, the dose is 0.15 milligrams or 0.15 mLs of epinephrine 1 to 1,000 concentration. The dose for patients weighing 30 kilograms or more is 0.3 to 0.5 milligrams or 0.3 to 0.5 milliliters of epinephrine 1 to 1,000 solution. Epinephrine is administered in the lateral portion of the thigh as illustrated in the image on the right of this slide. You will practice the administration of epinephrine in your lab sessions. Once epinephrine has been administered, nebulized albuterol can be considered to help patients who are still wheezing. Remember that a side effect of diphenhydramine is a decrease in blood pressure, so we do not want to give this in the presence of hypotension. After epinephrine administration, please be sure to properly dispose of the auto-injector or syringe. The last thing anybody wants is a needle stick injury from a dirty needle. Be sure to record the time the epinephrine was given, along with the dose and the patient's response to the medication. A call for an allergic reaction should elicit a paramedic unit response. Be sure to notify the paramedic crew of all medications that were administered so they can continue treatment where we left off. So this brings us to the end of this presentation. Here we see the learning objectives for this module. Can you demonstrate each of these objectives? If not, consider going back to review any content that you struggled with. Thank you for watching this learning module.